Hi, this is Gary Orris. Good to see you back. I'm doing another medical vlog. It's been a little while since I've done one. First thing I want to stress this time of year is insurance. I can't stress enough that the insurance that you want should be a high deductible, which would lower your premium. Don't go trying to find that low deductible insurance. We get so confused with insurance. It's very confusing. Even from our perspective, it's still confusing. So work on getting the high deductible, lower your premium, pay cash for everything out of that. Consider Victory Direct Care. If there's any questions about that, go to victorydirectcare.com. I got some videos on there trying to explain it. It will save you thousands of dollars. Try to avoid using your insurance. That should be the objective. And the new thing that I have now is the Orris Vein Center. I've started doing vein ablations in my office on the other side of the office from where we normally are. It's a procedure where we try to treat deeper veins that are refluxing. And what refluxing means is that the blood, instead of coming back to the heart like it's supposed to, goes backwards. The valves aren't working correctly. And it's a progressively worsening condition. It has a number of symptoms involving heaviness, pain, achiness, restless leg syndrome, cramping. Your legs just feel tired. A lot of symptoms associated with it. If you've got varicose veins, if you've got spider veins, then that's symptoms of something going on deeper inside the veins, and it needs to be treated. And so I've had some people, and is it considered surgery? Yes, it is considered surgery, but it's really very minor as far as procedure. It's really no more difficult than starting an IV. The benefits are way up here, the risks are way down here, and those are the type of procedures we like, because they're safe and the benefit is great, and that's what we like to perform. I've had patients state that they were told they shouldn't come to me because I'm primary care. Remember, I may be doing primary care. I'm board certified emergency medicine, and so I've been trained to do more difficult procedures in more dangerous areas in the worst case scenario. So doing procedures in a vein that's got nothing else bad around it, this is a very simple procedure. And if you wonder about emergency medicine doing these procedures versus a vascular surgeon, well, probably one of the largest cardiovascular groups incoming hired a person to kind of run their vein program and do most of their veins, who is, guess what, board certified emergency medicine. So they understand that also. Here's what a competent valve looks like that prevents refluxing of blood backwards through the vein. And when it doesn't work, you have this incompetent valve that's showing the blood coming backwards, stretching the vein, causing increasing pressure, and that's where all the symptoms come from. Those symptoms I mentioned can be varicose veins, swelling, skin changes, leg pain, heaviness, ulcers, restless leg syndrome, risk factors, age, female gender, heavy lifting, multiple pregnancies, obesity, prolonged standing. And the legs, if they have these vein problems, start to look like these pictures here with skin changes, ulcers, varicosities, and then swelling, which is noted. Hi, this is our vein ablation room that we are doing the procedures in. We've got ultrasounds. Have a patient here that we just finished a vein ablation and everything went great. Ovi is our ultrasound tech who, come around here, you can see Ovi.
Hi there.
And so this is our room where we're specialized in doing these procedures. Piece of cake. This patient just did well with this one, and I just wanted y'all to see what the room looks like. This person's leg is going to look like Ginger Rogers when we're done. The problem is it's a guy, so I don't know what he's going to do about that. All right, so to finish up the vlog, of course I have to do something to keep you coming back. So three people end up at the pearly gates with St. Peter, and there's 2 doctors and an HMO manager. First doctor walks up, he's a pediatric surgeon, and St. Peter says, "Okay, doctor, why should I let you in?" He says, "I helped thousands of children with surgery to save their lives and help them go on." He says, "All right, you go ahead and go in." Next steps up the psychiatrist, and he says, "All right, doctor, what did you do?" He says, "Well, I helped thousands of people live better lives by helping them." He says, "Well," St. Peter says, "all right, you can go in." Up steps an HMO manager. St. Peter says, "All right, what did you do?" He says, "I got thousands of families cost-effective health care. St. Peter says, all right, I'll let you go in. Oh, but by the way, after 3 days, you have to go to hell.